At this time, I'd like to welcome our featured speaker today, Abby Tighe, to present her talk, The State of Public Health. Abby Tighe is a founding member of the National Public Health Coalition, or NPHC, an organization that aims to educate about and advocate for the protection and advancement of public health as a vital government service. Abby is a former CDC public health advisor, fired by the Trump administration in early 2025. Following her termination, Abby helped create Fired But Fighting, a grassroots effort to support fired federal workers that has grown over time, leading to the founding of the NPHC. Please join me in welcoming Abby Tighe.
I want to thank you all so much for inviting me to share my story and talk to you all a little bit about public health. Before I kind of get into the story, I want to tell you a little bit about why public health means so much to me. My family on both sides are mountain people, Appalachian, born and raised. And while I was raised in Atlanta, I think you get a lot of that cultural exposure when your family is deep root Appalachian people. And then, unfortunately, those communities have been really decimated by lots of different things, including the opioid crisis and substance use challenges. So I have lots of friends and family who have combated this directly, and I've seen the loss. And so that's one of the many things that kind of pulled me into this field. You know, public health is this community service-oriented field that is focused on collectivism and how we can build a community that is really strong and healthy. And I love the field, and it was the perfect place for me. So I worked in a couple different places and then found my way back to Atlanta and to the CDC, where I actually worked on substance use prevention for youth in rural communities out west. It was the perfect fit for me. I loved this job. And you know, working with the people at CDC, these are people who only care about the mission. They don't care about their own ambition. They don't care about making money. Like, they are there because they care so much about the work and people. So last February, just after the inauguration of Donald Trump, second time, there were lots of rumors about a potential, firing of federal workers, and that Elon Musk had come in and decided that he was going to come after waste, fraud, and abuse. And February 14th last year, I saw an 11 Alive news report that the CDC was expected to lay off about 2,000 people. I reached out to my supervisor and was like, hey, am I going to be fired? And she did not. So I spent my whole Friday frantically putting in notes and making sure my communities had all the information they would need in case I was fired, and that my colleagues had what information they needed to make sure that those people had the resources that they needed if I wasn't there. Which turned out to be a really good instinct, because I got a call later that afternoon from my supervisor that I was on a list to be fired, along with 2,000 other probationary employees. I'd been at the job for over a year, but I had a 2-year probationary period because I have a disability. It's a whole separate thing that we could talk about. But she didn't know when I would be fired, why I would be fired, and asked me to let her know if I was fired. The next day, on Saturday, I got an email at 5 p.m. telling me that I had been fired for performance issues, which was very funny considering I had just gotten a promotion and a cash bonus for my performance the previous year. And so this is the first kind of group of firing at CDC, and a lot of the people that were kind of caught up in this were young, early career folks, and we were mad, understandably. And because this firing came from someone other than CDC and our supervisors, we weren't getting any information. We didn't know what our health insurance would look like. We didn't know what the offboarding process would be like. There was no information, and nobody at CDC knew what to do. So myself and a couple of my colleagues who were fired, we wrote a letter to Secretary Kennedy and sent it to him, and then a lot of us are health communicators, so we reached out to the media and we sent the letter, and from there, we got to tell our story the way we wanted to. MSNBC was who reached out to us first, and we got to do this really amazing interview, and that kind of started this Fired But Fighting work. Because of the chaos and the lack of information, we started a newsletter, and we named it Fired But Fighting, to basically help all the fired people understand what it was like to apply for unemployment, what they should do with their equipment, like basic stuff. So we'd written all of these issues in March, and then there was another round of firings on April 1st. Another few thousand people fired. These were longer time career folks. And we happened to already have this resource that we put on a website that we could start to point to people to. And from there, Fired But Fighting kind of grew into this really incredible movement of public health people who wanted to support their community of people who had been fired, but also wanted to make sure that the American people knew what these cuts would mean for them and their communities. When this happened, they famously fired everybody who worked in the childhood-led prevention branch at CDC, while Milwaukee was having a lead exposure in elementary schools. So we used that opportunity to make sure the American public knew that the city was in crisis, and there was no experts for CDC to send. And we talked to Congress, we talked to our senators, we talked to media, and thankfully we were able to get that branch reinstated, along with another, couple groups of people, and some HIV work as well. So we've had some wins, but that firing and those reinstatements started kind of the National Public Health Coalition. In our conversations, particularly with Congress members, we realized that many of them and their staffers didn't know that 80% of CDC's money went to states and localities and communities. They didn't know that by firing all the staff, you were basically removing the conduit from the federal government down to the state and local levels for expertise and for, making sure people knew how to use their money and how to access it. So we decided that there was this large gap in understanding of just the basic systems of public health infrastructure at the federal, state, and local level, and decided that we were not okay with that. And so we've spent the past year kind of transforming into this organization that acknowledges that public health is political. It doesn't have to be partisan, but it does have to be political. And we've really done a lot of work to try to pull in people from all sides. We actually chose the name of our coalition because of some feedback we got from the former Surgeon General under Trump 1, Jerome Adams, who told us that he really liked the work we were doing and thought that it was important, but that if we wanted people to engage with us across the aisle, we had to make sure we could come to the table with a neutral name. And so we're really trying to do the work to make sure that we can bring in everybody and build a tent that is big and that is focused on community. Because I myself, and I think most people agree, that everybody wants to live in a safe community. Everyone wants to have safe water and food to eat. Nobody wants to live in a community that has lots of conflict. These are basic, things that I think everybody agrees on, and we might disagree on how we get there, but we have to go back to making people understand that there is a collectivism here that we all have to buy into. And so, this has started this advocacy organization that I did not intend to start or lead, and that none of my coworkers intended to do, but we feel that it's really important, and we've, started to work with partners across the country to, build up state and local public health individuals' ability to advocate for themselves and their communities. Because we can talk about the federal government, we can talk about CDC a lot, but we're not the ones that are doing the direct work. Those are your community healthcare workers, your nurses, your doctors. We have to empower them and give them the tools to, advocate for their community. And so we're really, really hoping that we can do that over the next year, and that we can mobilize people to care about public health. And yeah, it's been a wild year, but I know that it can feel like things are crashing down, and that it is that the fall of public health and a lot of the democracy that we rely on in this country is crumbling. But I want you to know that there is resistance. Every single agency in the federal government has an organization similar to ours. There are people fighting all the time. We have friends at NASA, at NIH, at the DOJ that are doing their work to resist internally and externally, and it's going to be a long fight, but there are a lot of people that are really dedicated to the fight for democracy and for health, and for the idea that we can build something one day that is better than what we had before, because it is no question that the system we had before did not work for everybody, and does not work for everybody, and we're seeing this as an opportunity to reaffirm our values and to build something that is better for our people. And so I hope that you will all join our journey in following what we're doing and talking about public health. And I'm so thankful for the opportunity to come and talk to you all today. Thank you so much.
We have about 7 minutes left, because we always give our speakers at least 20 minutes, and Abby, you were so concise that you only took a portion of that. So if people have questions that they'd like to ask, raise your hand. So we have Marcia first, and then Ted.
All right.
Marcia.
How can we support y'all?
Yeah, so we have, thank you. We have a website, 2 websites actually. The National Public Health Coalition, which is nationalphc.org, and firebutfighting.org. You can just keep up with what we're doing. You can sign up for our newsletter on firebutfighting.org. We sell merchandise. If you like spicy merchandise about public health, there's lots of fun merch on there. There's also the CDC Mutual Aid, which is not our organization, it's separate, but we donate a portion of our proceeds to them. And the CDC Mutual Aid is providing rent coverage and different kinds of coverage for people who were illegally fired and are struggling to find a new job, or are waiting for a lawsuit to kind of come out to determine if they'll get their jobs back or not. So those are a few ways that you can engage with us. There are lots of protests, so if you keep up with our website or our social media channels, you'll see opportunities to go protest. There is a March for Science, I think, on March 7th, which is next week. We have a day of service that we're doing also on the 7th. Yeah, so I think you can follow along, and there are lots of ways that we offer for people to engage.
That's one other. I had heard that, just in the grapevine, that a lot of people who worked for CDC, because of their expertise, it was difficult to find a job here in the United States, and that many of those people were going to Europe. Is that true?
Unfortunately, it is true. I have a really good friend who is an infectious disease doctor who focused on immigrant health at CDC, and she's since moved to Italy with her whole family, and so there are definitely people who are leaving. We're losing generations of scientific expertise and future, right? It is hard for people to want to go into this field when it is under attack, and so there is some concern about that. But, you know, even our friends who have left and are in other countries are still fighting with us, just from abroad. So there's dedication across the world for this.
And I'll email with you so you can send me links to all these resources, and we'll include that in our e-blast.
Yes.
Ed?
Yeah. I'm just curious about press coverage on it, because it seems like every time some right-wing nut says or does something stupid, we get a week's worth of coverage debating what they did. And I hadn't heard about that every federal agency has an organization. I feel like there should be a daily report in the New York Times from each one of those.
We're underground for the most part.
On purpose?
Yes, we have a lot of current federal employees,
Okay.
and so there's like a very big safety issue with folks that we're trying to keep safe. So we're probably the most forward-facing group right now, but there is a large network of folks that are working on resistance.
Thank you.
Jan?
I just want to say thank you.
Of course, thank you for having me. I really appreciate it.
Can you bring in, how does USAID relate to CDC? Was that intertwined?
Yeah, so USAID has this interesting relationship. There's actually been contention for a long time between CDC and USAID about who does what. But USAID and CDC often have to work together. Money for global health, including PEPFAR, which is HIV prevention and treatment and screening globally, that money goes to USAID through the State Department, and then CDC works as a partner with them to basically implement that money. But my understanding now is that because USAID has essentially been wiped out, money is still being sent to a lot of countries who, you know, are getting PEPFAR, but they're not having, it's delayed, they don't have the expertise or the connections of people to like distribute medication or testing. And so there is some concern globally, particularly in the HIV space. You know, I can include a resource, there's a resource that estimates the number of deaths from HIV globally as a result of the dismantling of USAID.
She'll send it.
I'll send it so you guys all can have access to it, yeah.
All right, well, thank you so much. If you'd like to speak more with Abby following today's celebration of life, but thank you again, Abby. All right, it is time now for our final congregational song. Craig, what's it going to be?
Back to the Pink Book, number 65. 65. We shall not be moved.
Please rise and bow to your spirit as you are willing and able.
And I want to suggest when we get into the first verse where it says union, I want to say, let's say protest today. The protest is behind us.